third year of doing this. I know I did it the first year, and then Dr. Tessitore did it last year. And so we thought, you know what, from now on, we're just going to do it combined. It's going to be a lot more fun. You'll get a lot of different perspectives that way. So today it's going to be both Dr. Shopvik and I. Of course, this is always that reminder, right, that this is information. It's not the same as coming in to see one of us and getting individualized recommendations or care for your specific situation. When we get to questions at the end, that'll be another thing to keep in mind. You know, really specific individual things are going to be better discussed with us in person rather than at a Q&A at the end of this presentation. And give me just a moment to admit some more people from the waiting room. Here we go. Okay. Oop. And of course, a Zoom courtesy reminder, please mute your microphones during the presentation. I went ahead and muted some folks already who free to enter it into the chat bar, and that's how we'll do all of the different questions at the end of the presentation. Let's get started. Today, we are going to talk about quite a few different things. We're going to talk about the prevalence and types of hearing loss, how to protect your hearing and different risk factors with hearing loss. We're going to talk about hearing loss and, of course, that link with cognitive decline. Then we're going to switch over to some newer topics, tinnitus, over-the-counter hearing aids, communication strategies, and other resources to help you hear your best. So, of course, we're going to start with the basics. How common is hearing loss? Hearing loss is incredibly common. 1 in 3 adults age 65 to 74 years old have hearing loss. 65% of adults 71 and older have at least some degree of hearing loss. And 96% of folks age 90 years and older have hearing loss. So hearing loss essentially becomes universal in our 90s. Hearing loss is the third most prevalent chronic condition as we continue to age, and it's even more prevalent than diabetes and cancer. So it is third after heart disease and arthritis, as you can see from that image in the bottom right-hand corner. Hearing loss happens very slowly over time, especially age-related hearing loss. Many adults ignore study in 2022, on average, hearing aid users wait about 5 years from their initial diagnosis to be fit with their first set of hearing aids. Now, that 5 years may seem like a long time between having a problem and doing something about it, but actually that number used to be 7. So we are seeing that more people are taking control, realizing they're having a problem and doing something about it. So first, let's just talk about the basics of what's happening in the most common type of hearing loss, which is age-related. And of course, the sound enters the ear canal. It goes through that eardrum, it hits the eardrum, goes through those middle ear bones, and then enters the inner ear organ of hearing, the cochlea. And that tiny little snail-shaped organ is full of all these little hair cells that catch the sound vibration and send it up a nerve to the brain. And so in the vast majority of hearing loss and age-related hearing loss, it is damage to that little snail-shaped organ, the cochlea, and those little hair cells. But of course, other parts of the system can be impacted and have hearing loss too. Some of you may remember a time when your ear was completely clogged with wax and that caused a temporary hearing loss. Or if you think of little babies who have ear infections, their middle ear is full of fluid and the sound doesn't transfer as well that way either. And so there are many different causes of hearing loss. I'm just going to mute someone real quick. Okay, we'll keep going. Like I said, the most common type of hearing loss is damage to those hair cells of the inner ear. The number one cause of that is age, but there are many other reasons and factors that go into it. Genetics can be a huge part. From my genetics coursework for my doctorate, there are actually over 200 different genetic factors that can cause those hair cells to be more or less fragile and susceptible to damage as we continue to live. Noise exposure is another huge one. How many times those little hair cells are blasted by tidal waves of loud sound. Eventually, they just don't grow back the same way. Disease and infection can cause issues too. These little hair cells are just so incredibly fragile. They're susceptible to so many different things. Autoimmune disease is a big one, lack of blood flow to the ear, and certain medications and chemotherapy. So, a lot of bodily system things are very connected to the inner ear. The inner ear is actually only the size of the tip of our pinky. And so it's just very tiny and very sensitive to other large systemic changes. So keeping in mind that that inner ear is so fragile, we want to do everything we can to try to protect it for as long as possible. And as I touched on with noise-induced hearing loss, hair cells, you can think of them like grass. And every time they're walked on or trampled on by loud sounds, eventually they just don't grow back the same way. And so that's why it's really important to make sure to protect your ears from loud sounds.
Putting the rest of these in.
Of course.
We need more.
I need a bun.
Let me mute someone real quick. Okay. Now, let's talk a little bit more about the details with protecting our hearing. You can see from that chart on the right, anything 85 decibels and louder over time can cause damage to your ears. So yes, your espresso bean grinder can damage your hearing, your blender for smoothies and your blow dryer can cause damage to hearing over time. The big thing to keep in mind is when the sound is going on for a long time. So, like a concert where it's multiple hours, right? Versus a blow dryer, which is only going to be, maybe a few minutes. When you are somewhere that the sounds are so loud that you have to yell to be heard over the sounds. So like a noisy restaurant or a bar, a concert, a construction site, all those kinds of places. There are three things you want to think about with how to protect your hearing. Reduce the sound. Can the sound just simply be turned down? If you ask the waiter, can the restaurant turn down the music? That would be a great solution. If that's not an option, can you get distance from that loud noise? Can you sit out on the patio or farther away from the band that's playing? Where you're having dinner that day. And then, of course, the third thing to keep in mind is if you can't get away from the sound or turn the sound down, protect your ears using earplugs, ear muffs, all that good stuff. Now we're going to tie back into how our hearing, we want to preserve the good hearing that we have left, but it's also connected to a lot of the systemic issues in our body. Diabetes, osteoporosis, smoking, kidney disease, and cardiovascular disease all put someone at an increased risk for hearing loss because they affect that fragile inner ear. And so something that's just good to keep in mind throughout the aging process is anything that's good for your heart or good for your brain is usually going to be good for your ears. Another thing to keep in mind with the hearing process is that we hear with our ears, but we understand with our brain. So taking good care of our brain health helps with a lot of the processing difficulties that some of our patients come in with. This is a chart here showing the average age or the average hearing loss by age. And as you can see, a 20-year-old, pretty much has normal hearing. Then you go 40 years, 60 years, 90 years. There's that drop in the high frequencies, and that is because the inner ear, it is most sensitive in the high frequencies first. That's where the damage typically shows up with age-related hearing loss. And so it's not at all common for our patients to come in and say, I'm struggling more with women's voices, or I'm struggling more with, like an SSH sound, and that's because those are in the higher frequencies. Next, we're going to talk a little bit more about untreated hearing loss and that connection with cognitive decline. I know I did talk about this 2 years ago in our presentation, but there's been quite a lot more evidence that has come out since then, so I figured it's a good topic to brush up on. Untreated hearing loss. I'm sure a lot of our patients, we've talked to you about this in person, but the big researcher that first came out with information of untreated hearing loss and cognitive decline was Johns Hopkins. And they were the first ones to find that hearing loss is actually a modifiable risk factor for dementia, meaning if you have hearing loss and it's treated, that risk factor for the dementia goes away. It's one of the only midlife modifiable risk factors for cognitive decline, which is really astounding and important to know. Untreated hearing loss in midlife accounts for that 9% risk. And so, of course, if you or someone else you know has hearing loss and isn't treating it via whatever that is, a cochlear implant, a hearing aid, that's a really important risk factor for cognitive decline to be aware of. That also goes for not wearing your hearing aids. If someone only wears their hearing aids when they go out to eat, 2 hours every day, their brain isn't getting enough of that stimulation, and that's still letting the hearing loss be a risk factor that could contribute to dementia. So, of course, there's been a lot more updates since that first study came out back in like 2012. The American Geriatric Society recently found people with hearing loss lose functional brain tissue and have 30 to 40% faster cognitive decline than their peers. In another study at Washington University, they found untreated hearing loss shrunk brain tissue 1.2 cubic centimeters per year more than people with normal hearing. And then again, Johns Hopkins continues to gather more data as more of their studies come out over time. And in a 12-year study, mild hearing loss doubled the dementia risk, moderate hearing loss tripled the risk, and people with severe hearing loss were 5 times more likely to develop dementia. This is a screenshot that I took this past fall. I think it was September 2023, of hearing loss being in the news, because of course we find that really exciting here. And you can see, more and more research is coming out on hearing loss, on dementia, and even here it showed a connection too with type 2 diabetes and hypertension. Moving right along, a hot topic that a lot of people have requested we talk about in our presentation is tinnitus, so I'm going to touch a little bit on that today. Tinnitus, let's first talk about what it is. And tinnitus, it's a potato kind of thing, so however you say it is fine. Tinnitus can be defined by any sound that is perceived by the listener that does not originate from an external sound source. It could be in one or both ears. It could be constant or intermittent. It can vary in volume and in description. It can be really acute. It can be really chronic. All these things apply, which makes it more unique to every single person who experiences it. Tinnitus and its prevalence, so how often people notice it. Over 500 million Americans notice tinnitus, or 1 in 6 people, or 16% of the general population. So if you do have tinnitus, you are not alone. It is a very common thing to experience. That being said, 20 million Americans report that their tinnitus is bothersome, and about 2 million report that their tinnitus is extreme or debilitating. Now, that is the more concerning group. It's one thing to notice there's ringing going on throughout the day, but if it doesn't bother you, if it doesn't impact your sleep, great, just let it be. But it's that group that finds it's bothersome where we really step in and need to do something about it. And then, of course, there's that huge connection. 90% of people with tinnitus also have hearing loss. Tinnitus is not a disease itself. Rather, it's a symptom of an underlying condition, and in 90% of cases, it is that connection to hearing loss. So for most cases, it is a sensory neural reaction in the brain to damage to the auditory system, which is a fancy way of saying damage to the inner ear. The top causes of tinnitus are presbycusis, which is a fancy way of saying age-related hearing loss. In those situations, it's usually in both ears or bilateral. And as I touched on before, most people with age-related hearing loss tend to lose their high-frequency hearing first. At the same time, the other common cause of tinnitus with hearing loss is noise-induced hearing loss. Usually this is also in both ears, but it can be in one ear, especially if the noise exposure was specific to one ear. So for example, if you are a right-handed shooter, you have a long history of using firearms over many years, your head actually tilts a little bit more to the right side, leaving the left side more exposed, and that ear will tend to have more hearing loss, and it's more likely to then have bothersome tinnitus. There are also many other causes. So as I said, 90% of tinnitus is connected to hearing loss. The other 10% can be so many things. It can be earwax or other things stuck in the ear. It can be middle ear disease, like fluid in the middle ear, head and neck trauma, right? Stress on that spine, sinus pressure, traumatic brain injury, TMJ, all sorts of different medications. The list goes on and on and on. So we often receive physician referrals for tinnitus. That is because the vast majority is connected to hearing loss. Often the physician will just want to know, is it connected to hearing loss or not? Because if it's not, they have to look through this whole other list of many other things. There are also things that can make tinnitus flare up or exacerbate it. Caffeine is a big one. So is alcohol, smoking, use of certain drugs, lack of sleep, stress, anxiety. All these things really ramp up the system to make tinnitus worse. So now that we know how common tinnitus is and what people experience, let's talk about some different treatment and management options. There are many, and as I mentioned before, no two tinnitus patients are alike. So you really have to take kind of a unique approach with each person. Cognitive behavioral therapy is a really good solution for folks who've tried a lot of other options and nothing else has worked. Relaxation and exercise, things to help get the brain to calm down and manage stress can help with tinnitus. Sound enrichment, like playing music, having a sound machine or a rain machine on in your house, playing audiobooks, podcasts. This is where hearing aids and hearing aids with custom tinnitus maskers come into play as well. Different kinds of therapy that help habituate the tinnitus into your day-to-day. Protecting your ears from loud noise because that would prevent the tinnitus from getting worse. And of course, considering professional counseling and support groups. And as I mentioned, since every tinnitus patient is unique, usually combining multiple strategies is going to be the best approach. Let's dive into a little bit more about sound enrichment. This is a really successful form of tinnitus management and strategy for about 60% of bothersome tinnitus patients. With sound enrichment, we're thinking, how do we get the brain to hear more sounds so that it's less focused on that one stressful sound? And if it hears those other sounds, then it'll pay more attention to those and less on the tinnitus sound. So think of sounds from the environment or amplification with hearing aids or other sound generating machines. They stimulate the hearing system, which can blend with or cover up the tinnitus. As I mentioned, one study found 60% of patients reported significant relief from tinnitus by just wearing hearing aids alone, giving the brain back the sound that it was missing, so it was less focused on that phantom sound it had created when it first noticed the hearing loss. Tinnitus maskers in hearing aids are another step up that can be used if wearing hearing aids alone is not enough. They can be shaped to the pitch and loudness of your tinnitus to provide relief, and your audiologist can help you more with this after a tinnitus evaluation. If you want to learn more about tinnitus, I would highly recommend the American Tinnitus Association. Several years ago, when I talked about this, I just said, go on their website. It's great. I actually went on their website more recently. It is $50 a year for a membership, which may seem like a lot, but if you are someone with tinnitus who is really curious about what can be done more, they are the gold standard of all things reputable regarding tinnitus. There is so much misinformation out there that I highly recommend them. And that $50 gets you a load of different articles, all the way from, very scholarly to easy to read. You get a magazine quarterly, I believe, that gives you up-to-date information on research. So it's really good value for a year of learning more about a very mysterious problem that a lot of people say the wrong thing about on the internet. Okay, and with that, I am going to hand things over to Dr. Shapovic, who's going to talk to you about over-the-counter hearing aids.
Thanks, Dr. Egan. We're going to talk about OTC hearing aids now, or otherwise that's over-the-counter hearing aids. So what are the new over-the-counter hearing aids I've heard about on the news? So I'm sure you guys have seen them on TV, or maybe even at Best Buy or Walmart or any kind of big box store. So we'll kind of do a comparison first with OTC versus prescription hearing aids. So if you go see an audiologist, we're going to run real ear measurements, and that is how we properly program your hearing aids, and make sure we're getting the correct prescription of sound for you based on the hearing test that we do in the clinic. For OTC hearing aids, you would get those at a big box store, like I said before, Best Buy, Walmart, CVS, and those you can purchase without seeing an audiologist or without getting a hearing test in the first place. So other things about OTC hearing aids. So these are really only meant for those who have a perceived mild hearing loss. So anything greater than that, they're not going to suffice. You're definitely going to want to look into a prescription hearing aid if you have greater, than a mild to moderate hearing loss. I kind of compare them to the reader glasses that you see. So it's not a prescription. It's really just amplifying everything pretty much. OTC hearing aids, they're not programmed to your hearing loss or your hearing loss prescription. It is a one size fits all, and they are self-fitting. So you would fit them yourself at home. A reputable hearing aid clinic will have, prescription hearing aids that are very similar in price to the OTC devices. And the nice thing about the prescription aids is they can be customized to your needs. And like Dr. Egan was talking about before with the tinnitus, you can have tinnitus programs in your prescription hearing aids, and that's something you can't get with the OTC devices. And then the last thing you want to make sure too is if you do purchase over-the-counter hearing aids, to look at the trial period, because a lot of the times people will try them, but they don't end up working for that person. So just keep an eye out for that in case you do end up or wanting to return those devices. Here is just a little graph to kind of show you again what we just briefly talked about with prescription hearing aids versus over-the-counter hearing aids. So if we start at the top, the selection process and the hearing loss severity. Again, prescription hearing aids, you're going to get a full comprehensive evaluation in our sound booth. And if you wanted to also do a tinnitus evaluation, we do that too in the booth. And prescription hearing aids can fit all degrees of hearing loss, so mild, moderate, severe, profound. If we look at the other side for over-the-counter hearing aids, sometimes there will be an online hearing test, but most of the time there's no hearing test at all, and it's a self-perceived mild to moderate hearing loss. Again, prescription hearing aids, they're fit by a doctor of audiology. If you go with OTC, you do have to fit them at home, which can be a little bit difficult. Price-wise, they're very comparable. At Now Hear This, we have many different levels because we want to make sure every hearing aid or any type of hearing aid is accessible to everyone, no matter the situation. So a price of a prescription hearing aid is going to vary anywhere from $1,000 to $7,000. And then over-the-counter hearing aids, again, they're usually around $1,000, $1,500, but you would have to check the vendor because each one is different. And then we drop down to the bottom for design and features. Prescription hearing aids, again, can do a lot more than the over-the-counter hearing aids. So they have things like noise reduction, microphone directionality, speech clarity is going to be different. And over-the-counter hearing aids, again, think of like reader glasses. So it's just kind of amplifying all of the sounds. There's not really any other technology involved there. Another nice thing about the prescription hearing aids, if you wanted to get a custom in the ear style that goes all the way down inside the ear canal, that is an option. The over-the-counter hearing aids, they have to follow certain restrictions. So they have to make sure that the hearing aid doesn't sit 10 millimeters from the eardrum. There needs to be a little bit of space there. And then lastly, for follow-up care with prescription hearing aids, we always, after the first fitting, we do a 2-week follow-up just to check in with you, see if you need any other adjustments. And there's continuing ongoing care. We always recommend after you're fit and you're good to go, after all the follow-ups, we do recommend coming in every 6 months for a deep cleaning. And then with over-the-counter hearing aids, there's not really any ongoing care with the audiologist. So now we're going to talk about communication strategies and how you can help someone who has hearing loss, how you can help communicate better with family and loved ones. So communication can be impacted by multiple things. As we all know, background noise is a struggle. So especially when you're in, those restaurant settings, it's always pretty difficult because it's just so loud in there. Echoes. So if a room has really high ceilings, or if you go to church, a lot of the acoustics can be poor because of the high ceilings, the distance from the sound source, the visibility of the speaker's face, the listener's hearing status. So whatever their degree of hearing loss will impact communication as well, and the speaker's voice and accent. So accents can always be a little bit more tricky too. So communication strategies for the speaker. So you always want to make sure you're getting the person's attention first. So you may want to say their name before you just start talking. You want to make sure that you're facing the person so that they can read your lips. I know when COVID started, people didn't really realize how much they relied on lip reading. So that was a struggle for a lot of people. So you definitely want to make sure they can visualize and see your lips, because that will help them. Always speaking slowly, enunciating your words rather than just screaming or shouting at them. You may want to rephrase what you're saying to them rather than just repeating the same sentence. Using facial expressions and gestures to give clues is also a great tip. Removing background noise if possible. So if maybe you're in a restaurant setting, maybe asking the hostess if they can seat you somewhere where the noise isn't too bad, or maybe even sitting outside where there's not a ton of people. You don't want to use sentences that are too complex, and you want to give specific information and ask the speaker to repeat. But the most important thing always is just to be patient with anyone, but especially your loved ones. And then communication strategies for the listener. So this is for the person that has the hearing loss. The number one I always, tell my patients is to advocate for yourself, especially if you're still working or in the workplace, because we want to make sure that you get the proper accommodations for that. Be assertive. Tell people how they can best help you, because they may not know that you have a hearing loss. Asking people to speak more slowly or more clearly. Again, you want to position yourself close to the speaker so that you can read their lips. Like I talked about previously, moving away from background noise if possible. I know that can be hard in some certain situations. And then be specific if you can't, or if you miss the sentence or what that person was saying. Just ask more specific questions rather than just saying what. Sometimes it also helps to repeat what you heard to make sure that what you heard is correct. And then always plan ahead and be patient with yourself, and always give yourself some grace there. So next we'll talk about the 5 Keys communication training program. So this is a program you can sign up through our clinic. So if you are interested, just let us know. You can write in this chat box or just email us at the end. And this is something we can sign you up for. So what 5 Keys is, it's a free communication training program that lasts 12 months. You'll get a weekly email that's going to teach you a bunch of different things. So it ranges from strategies, communication strategies, similar to what we just talked about. If you wear hearing aids, it's going to send you emails too about hearing aid cleaning tips, maintenance, troubleshooting, things like that. There's also some fun games and activities to help reinforce those communication strategies. And then they also are going to have really good resources and links to other organizations to help, to help you learn more about, hearing loss and hearing aids and all of that good stuff. So next we will talk about wireless accessories for your hearing aids. It looks like one of the images at the top got cut off, but that's okay. So if you do wear hearing aids and you feel like you're still struggling in a background noise situation, or you really just need like an extra help, this is when we may want to look into getting an accessory for you. So all of these devices listed on this slide can be paired to your hearing aids. So the first accessory is called a mini microphone. It's a really small little device. It can do multiple things. One of the things it can do is make hands-free phone calls. So if you wanted access to that, you can just have your microphone on you, and then that way you don't have to hold the phone directly to your mouth. Another great thing it can do is it can listen to someone speaking at a distance. So if you guys are at dinner, your loved one can clip it to their shirt, or there's a lanyard you can wear as like a necklace, and their voice is going to go into the microphone and stream directly to your hearing aids. And then another thing it can do too is if you are on your computer a lot doing Skype or Zoom calls, you can use the mini microphone for that, so that you can stream whatever is on your computer to your hearing aids. Another really awesome accessory is the Phonak Roger. And you can use this device not just on a Phonak hearing aid, but this is going to be really good for those who their main issue is that background noise. So it improves speech recognition in noise and at a distance. And again, it's doing something similar to the mini microphone. It just streams directly to the hearing aids. But this is really going to be a really great option to combat any reverberation or any background noise in the room. And then lastly, another great accessory are the TV streamers. So this is really nice if, you know, you and your partner or your partner might complain, oh, the volume's way too loud. I need that to be turned down. This might be a good option for that. So we would pair your hearing aids to the TV streamer in the office, and then you go home, connect it to your TV. It comes with all the cords and the wires that you would need. And then the TV streams directly to your hearing aids. So this really allows you to watch TV at your preferred volume, and then the rest of the family can keep the volume at a level that works for them.
Oop, there's the photo.
Oh, there's the picture. So next, we can talk about assistive listening devices. So there are many, many devices out there that can help you too with your hearing loss, all the way from alarm clocks, fire alarms, carbon monoxide detectors. And if you are a nurse or work in the medical field, there are even amplified stethoscopes. But first, at the top left are that's what an alarm clock may look like. And I included a little website on the bottom under alarm clocks if you wanted to go check out their devices. But there are many different alarm clocks that if you're concerned you're not going to hear them because you're not wearing the hearing aids when you're sleeping, you can get an alarm clock that will have flashing lights or just emit like a really loud sound. There are even vibrations that will help to wake you up. And then next to that alarm clock picture is a caption call phone. This is a really good resource and it's free. The caption call, basically how it works is they come to your house with that caption call phone, and the conversations are displayed on that little screen right there. And the text, you can change the font size. So it's really customizable, and also it's just a really good resource if talking on the phone is an issue. There are also fire alarms and carbon monoxide detectors. Again, these are going to be helpful if you might be afraid that you're not going to hear the alarm. So they will come with flashing strobe lights. Also, they have ones that vibrate too. And then lastly, amplified stethoscopes. So these can connect to hearing aids. Again, this is only going to be for people who are in the medical field, but there are many different options for pretty much everyone. All right, and to cap everything that we learned today, so number one, protect your hearing. That's so important. We want to take care of your overall health, including your hearing health. It's always important to schedule a baseline exam. So even if you're not sure you have a hearing loss, you know, when you hit that age around 55, 60, you may just want to go in for a baseline to see where you're at. You always want to make sure starting sooner rather than later so that we can keep the brain healthy, limit any cognitive decline from happening. And we want to also make sure that your hearing aids are programmed with real ear measurements and are not locked. And not locked, that just means so if you go to a clinic like Miracle Ear or one of those dispensers, sometimes they do lock the hearing aids. So if you go to a different clinic, they may not be able to program it for you. And then lastly, communication strategies, in addition to those assistive listening devices, are someone's best chance at communication success. And again, thanks for coming. We really appreciate everyone who joined in on today's call. And to give back to all of you guys, if you email Nathalie, her email is listed right there. And if you email the code Better Hearing, we will put your name in a raffle to get a free clean and check on your hearing aids.
And same goes if you are interested in the 5 keys to
Yes.
communication, email Nathalie, and she can help get you enrolled in that. The next slide is just basically Q&A, but I figure we'll leave it on this slide in case people are trying to email Nathalie at the same time. So if you do have any questions, if you could enter them in the chat bar, we'll get going with those. And Dr. Shopovic, can you see the chat bar from where I'm screen sharing? I can't see it.
Let's see. I can't see the chat.
Let me try to figure that out.